Ozempic and Wegovy weight regain shock, study reveals 8-week rebound. The promise and perils of weight loss medications. What happens when you stop? In a concerning revelation for anyone considering popular weight loss medications, new research suggests that stopping drugs like Ozempic and Wegovy could lead to rapid weight regain, and here's where it gets interesting: it can happen in as little as 8 weeks. A comprehensive research review published in BMC Medicine has analyzed data from 11 clinical trials involving nearly 2,500 participants, revealing a troubling pattern that many healthcare providers worried might emerge. But here's the part most people don't realize: the weight regain isn't just a minor setback, it can continue for up to 20 weeks after discontinuation. Currently, medical professionals have 6 FDA-approved medications in their arsenal to combat obesity: orlistat, naltrexone bupropion, semaglutide, liraglutide, tirzepatide, and phentermine topiramate. Semaglutide, the active ingredient in both Ozempic and Wegovy, was the focus of 6 out of the 11 trials reviewed. While these medications have shown impressive results during active treatment, the aftermath of discontinuation tells a different story. In one eye-opening example, patients who completed a 36-week course of Tirzepatide lost significant weight, only to regain almost half of it after switching to a placebo. Think about that: half of their hard-won progress reversed. The study, conducted by researchers including experts from Peking University People's Hospital in China, analyzed data from 1,574 treatment participants and 893 control group members. They discovered that weight rebound typically begins around the 8-week mark after stopping medication and continues for approximately 20 weeks before leveling off. Interestingly, the extent of weight regain varied based on several factors, including the specific medication used and, perhaps most crucially, the patient's commitment to lifestyle changes. This raises an important question: are these medications creating a dependency that makes maintaining weight loss impossible without them? Originally prescribed for obesity and type 2 diabetes patients, semaglutide has now entered the mainstream as an off-label quick fix for weight loss. But here's the controversial part: are we setting patients up for a cycle of loss and regain by not addressing the root causes of weight gain? The researchers emphasize the need for longer-term studies to better understand the factors influencing post-medication weight changes. What do you think? Are these medications a sustainable solution for weight management, or are we just creating a new form of dependency? Share your thoughts and experiences in the comments below. Study reveals significant weight regain after weight loss drugs, Ozempic and Wegovy insights. Here's a shocking truth about weight loss medications: they might be setting you up for a rebound you didn't see coming. Recent research has uncovered a critical issue that's rattling the healthcare community. Patients taking popular weight loss drugs like Ozempic and Wegovy could see their hard-earned results vanish within weeks of stopping treatment. But here's where it gets controversial: are these medications just a temporary fix, or are we missing the bigger picture? Let's dive into the details. A groundbreaking analysis of 11 clinical trials, published in BMC Medicine, reveals a troubling pattern: after patients discontinue anti-obesity drugs, their bodies often launch a counterattack. The study tracked weight changes over time and found that significant weight regain typically kicks in as early as 8 weeks after stopping medication, with the trend peaking around 20 weeks. Imagine working tirelessly to shed pounds, only to watch them creep back like an unwelcome guest. The data shows that on average, this rebound phase lasts about 20 weeks before stabilizing, though for some, the effects could linger longer. Researchers emphasize that no two cases are identical. For instance, the specific drug used, like Ozempic's active ingredient semaglutide versus other formulations, and the patient's commitment to lifestyle changes, think diet, exercise, and behavioral therapy, heavily influence how much weight returns. But here's the part most people miss: even the most effective medications can't override poor habits. If someone stops exercising or reverts to unhealthy eating after quitting their medication, the results will likely crumble. The study authors are now calling for long-term research to understand how these drugs interact with human physiology over years, not just months. And this is the part that sparks debate: should these medications be considered a lifelong solution, or are we setting up patients for disappointment? What if the real fix lies not in the drugs themselves, but in the lifestyle changes we're not prioritizing? Share your thoughts in the comments. Do you think weight loss drugs are a helpful tool, or are they creating a false sense of security? The conversation is just getting started.